aging and awesome. There are so many changes in our bodies as we age, and for men, a very common one is dealing with an enlarged prostate gland, also known as BPH. That's benign prostatic hyperplasia. And Dr. Brian Evans with Comprehensive Integrative Care is here with us again. Thank you so much for coming back on the show to talk about this important and very painful. What are some of the symptoms of this issue?
So men with an enlarged prostates, and honestly, we all start losing hair, or hair gets thinner as we age, but our prostates just keep getting bigger. And most men at some time in their life will start experiencing symptoms of difficulty starting urination, getting up a bunch of times at night to go to the bathroom, and difficulty with complete emptying of the bladder. So a way to treat that in the past has been more invasive surgeries in the hospital with prolonged stays and catheterization, but now there's prostate artery embolization where we can treat it minimally invasively.
And being a guy, we like to wait a long time before figuring things out. That's an issue with this, right? Do you see a lot of patients that wait way too long to get this taken care of?
Yeah, men will wait a long time, one, hoping it'll go away, which it won't, and two, they just don't like the options out there of how to treat it. So they just keep putting it off, and the symptoms will just continually get worse.
So medication is an option, surgery is an option, but you have another approach to it.
That is correct. That's the prostate artery embolization. So it's a minimally invasive procedure done in an outpatient setting, so easy parking, easy navigation into the center. The procedure takes about an hour, and we go through a small little nick in the skin of the upper thigh, get into the arteries of the pelvis, and then under X-ray, we inject contrast, can see all of the arteries of the pelvis, namely the ones that are going to the prostate gland. Once we identify those, we can then decrease the blood flow to the prostate gland, and then the prostate shrinks over time and relieves the symptoms on the bladder.
It's so important that people have tons of different options in the healthcare field, especially today. And as medicine continues to progress, I'm just continually amazed that it becomes less and less invasive, it seems.
It's incredible the way medicine is moving now towards minimally invasive procedures, and interventional rheology is on the forefront of this.
And I know you have a patient who's had a wonderful experience with this procedure. Let's have a look.
What's made me the happiest about the procedure is that I can sleep now. My wife loves it because every time I would get up, she would wake up. So her sleep was affected as well. And now we both can get a good night's sleep, and that's the main thing for me. I can't tell you how much better my life is now compared to what it was. I was literally dying. I was dying, and I can't thank Dr. Evans enough for what he did for me.
We are very happy for this patient and thrilled with the response.
Absolutely, we're happy for him as well. If you'd like to get in touch with Comprehensive Integrated Care, you can so there at the number on your screen. Dr. Brian Evans, thank you so much for coming on the show.